We know that infants can become very sick from RSV in the first 6 months of life. That's when they're most vulnerable and they can't receive their own vaccine. So really the best strategy to protect the neonate and infant is for the mother to be vaccinated in pregnancy.
While a number of other RSV vaccines have come on the market over the last several years, only Abrysvo is approved for use in pregnancy to generate maternal immunity and to protect the neonate.
So if patients want to know how Abrysvo works, we can tell them that it helps the mother's body make antibodies that then are transmitted across the placenta to the fetus and persist in the infants for up to 6 months of life, providing that protective immunity.
So the current recommendations in the continental US are for patients who are pregnant to receive the vaccine between September 1st and January 31st. And that's because that's the time period that corresponds with the peak RSV season.
And so what we know now from the current guidance is that it is not recommended to get the RSV vaccine 2 pregnancies in a row in 2 successive seasons. So instead, what we recommend at this point is for the infant to receive nirsevimab, the monoclonal antibody, if the mother received the RSV vaccine last season.
In terms of timing of administration during pregnancy, the current recommendations are between 32 weeks and 0 days and 36 weeks and 6 days of gestation. And it should ideally be administered at least 2 weeks prior to any planned delivery so that there's the opportunity for maximal benefit.
We can be very reassuring that we know that RSV vaccination in pregnancy is very safe for the pregnant person and the fetus for both high and low risk pregnancies. The side effects are very mild, and some of the side effects might include things like injection site pain, headaches, muscle aches, but everything very mild, or many patients have no side effects at all.
And they absolutely can safely receive other vaccinations at the same time as the RSV vaccine, including the influenza vaccination, COVID vaccination, and Tdap vaccination.
A great thing about the vaccine is that it's widely available, and it should really cost the majority of patients $0.
For those patients who are having trouble with the financial burden of access to the vaccine, the Pfizer Rx Pathways program offers patients help with the copays so that they can still get the vaccination that they need to protect their baby. One of the key things, though, with all of this to keep in mind is that it's important to have these discussions with your patients early before they have to make that final decision about receipt of the vaccination.